Have a seat, please.
Doc Jenny, meron lang akong gustong i-consult kasi nga yung friend ko, actually gusto kitang lapitan last time nung nandun ka sa bahay.
Ah, okay. What about?
Kaya lang hindi tayo nag-abot kasi nasa Danias ata ako ng mga panahon na yun. Anyway, yung friend ko kasi, parang she mentioned na parang lagi daw, parang ang dalas nung pag-ihi niya.
Like how often siya pumupunta sa washroom to urinate?
Parang more than, if I'm not mistaken, parang mga more than 10 times
More than 10 times a day. How about at night?
Maraming beses din eh. And hindi rin siya sobrang matanda pa ha.
Okay,
Siguro
how old is she?
Same, more or less mga same age ko po, nasa 30s. So, she's actually concerned kung anong condition yun. Is that normal? Ano ba?
Well, definitely it's not normal.
Yes.
Why? Because first it's bothering her. You know, what is normal is actually urinating every 2 to 3 hours and going to the washroom and urinate less than 8 times in a day. And of course, you should not be getting up at night. If you have this kind of problem, she might be having what we call the overactive bladder syndrome.
Ano yun?
When you have overactive bladder syndrome, you have urgency, you feel like you want to go to the washroom very often, you have frequency, you go more than 8 times in a day, nocturia, you get up at night, and then we have urge incontinence, yung when they feel like they want to go to the washroom, even if they're rushing and crossing their legs, they don't make it, they leak. This is actually what we call the overactive bladder syndrome, which happens to all age groups.
So, it doesn't matter if you're young or old?
Yes. Kaya lang, mas madami dun sa mga elderly with overactive bladder, non-stop na nagko-contract yung bladder mo.
That's why.
Yeah. And you know, it can be genetic. It can also be, it's inherent in your muscle to just keep on contracting. But you know, it is treatable.
How po, Doc? How do you treat
Well,
this kind of condition?
well, I'm happy to tell you we have medications, anti-muscarinic medications, which we can give to the patient that will relax the bladder.
Okay.
So, if the bladder is relaxed, it can accommodate more urine, right?
Yes.
So, the frequency of voiding will be less. But you know, there are intractable cases, like especially for the elderly, that I need to inject Botox in the bladder.
Wow.
Because diba, the Botox will give a little semi-paralysis, right?
Yes, parang nire-relax yung
Yes.
muscles. Doc, may mga ways ba to avoid this? Or talagang it's genetic and you know, you just have to face it?
Definitely, let's say if you're very prone to infections, you have to drink at least 2 to 3 liters of water per day, right? So, of course, proper hygiene. And then, don't take a lot of coffee. Why? Because these are actually bladder stimulants. It will stimulate your bladder to contract. So, coffee, tea, soft drinks would make the bladder contract. You know, even nicotine, like smoking.
It's very interesting to know na ganun palang ganito klase ng condition. At least yung friend ko, she will be more aware of what to do.
Right.
I'll tell her na pumunta dito one of these days.
Okay, sige.
Papa-appoint na lang siguro kami.
Sure, sige.
Thank you, Doc Jenny.
You're most
ha?
welcome.
La la